Hi, my name is Madison, and I'm an adult gerontology nurse practitioner student going to be performing an HEENT respiratory and cardiovascular assessment. So today I have here my patient. You can introduce your name and your date of birth.
Brant Camella, July 28, 1994.
Great. So upon assessment, Brant is oriented to person, place, time, situation. Brant is also personable. He's cooperative. I don't see any signs of distress, and his skin appears to be applicable to his ethnicity. I don't see any signs of cyanosis. So I'm first going to be looking at his head and his scalp. Based off of my inspection, I can tell that he does have multiple nevuses throughout. I'm going to palpate the area. The only hard mass that I feel is above his scalp here. It feels almost like an osteoma. And in his beard, I don't see any sort of suspicious lesions as well here. What I can tell looking at Brent is that his face is symmetrical, and I'm first going to perform the cranial nerve number 7 assessment, which is to test the facial nerve. So Brent, I'm going to have you raise your eyebrows, frown, smile, and blow in air, puff out your cheeks and blow it out. Great. So the next, I'm going to do cranial nerve number 5, which is going to be the trigeminal nerve. So I have here a sharp object and a soft object. So Brent, I'm going to have you close your eyes. I'm going to first start off with the soft. If you can just let me know if you feel it.
Yes, 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 yes.
Great. Now we're going to do the sharp.
Yes, 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 yes.
Great. And now you're going to tell me if you can feel either the soft or sharp object.
Sharp, soft, soft, sharp, sharp, soft.
Great. Now I'm going to test your corneal reflex here. So I'm going to have you blink for me, or you should blink. Great. Same thing on this side. Great. So that facial nerve, the cranial nerve number 5, the trigeminal nerve appears to be intact. So Brent, what I'm also going to have you do is kind of clench down here. I'm going to feel your masseter muscle, which I can feel is a hard kind of ball here, and I'm going to feel your temporal muscle as well. Keep clenching. Great. Now I'm going to have you open up your mouth and push against resistance. Great. And then I want you to move kind of side to side, open your mouth and push against resistance. Great. So we are now going to be doing the eye exam portion of this assessment. So if I'm looking at Brant's eyes, I see that his eyes are symmetric. They sit in the eye sockets equally. His eyelids, there's no swelling noted. The eyelashes, have a outward curvature to them. The sclera is white. The lacrymal apparatus, there is no swelling of that area. And the conjunctiva are pink, and there's no drainage noted. Brant's pupils are about a 4, and again, they are both equal. So Brant, I'm first going to test the 3 cranial nerves, which is cranial nerve 3, 4, and 6. So I'm going to have you stare at my pen light here, okay? And you're going to follow it. So far I'm checking for nystagmus, and that is not present here. Great. Now I'm going to have you do is you can stare off into the distance right behind me, and I'm going to test the corneal light reflex. And there's light reflection equally in both eyes. I'm going to be doing the uncover and cover test, so please take that card and cover one of your eyes. Keep both eyes open. Great, and uncover. Great, and do the same on that side. Uncover. Great, and both eyes did not move. So now I'm going to test for perla here. So again, bright light. The other pupil was reactive. The other pupil was reactive. And I have you stare at my pen light, don't move your head. Great, and Brant accommodated. So pupils are equal and reactive to light and accommodation. So now what I'm going to have you do is the fundoscopic exam here. So I'm going to be shining a bright light into your eye. So what I can tell is that the red reflex here is present. The optic disc is clear and has round margins, and there's no retinal hemorrhages noted. I'm going to come on the same exact side. So Brent, if you can turn your body here, just so we can get into the camera here. So we're going to do the same exact thing on this side. And I'm going to be switching hands here. Again, same exact thing. The red disc is noted. The optic disc, excuse me, the red reflex is noted. The optic disc is also noted here. It has clear round margins and no retinal hemorrhages present. We're now going to test for visual acuity with the Snellen chart, which I'm going to hang up here. So Brant, I'm going to have you start with your right eye. So please cover the left. Yep, cover the left. And I'm going to have you, Brant's about 20 feet from where it is. Brant, I'm going to have you read the line that you think that you can read completely.
All right. Second from the bottom. C, F, B, H, J.
Okay, so Brant got one wrong, so that's going to be 2024 because he read it at the 2025 line, but -1 because he missed one letter. So we're going to switch and do the other eye, the left one, again for me.
Second row from the bottom.
Okay.
C, F, D, H, J.
Okay, Brant got all of them right. That's 2025 vision, and Brant together with both eyes.
Bottom row. L, T, F, P, H.
Great, and that is 2020 vision. And it's important to note that Brant does wear contacts and was wearing them for this exam. I am now going to be performing the ear assessment on Brant. So when I was speaking to Brant, when Brant walked in, Brant had a steady gait. When I'm asking Brant questions, he appears to hear them and he answers appropriately. He does not appear to favor one ear over the other by turning into the question with that ear. So when looking at him, his ears are symmetrical. I can notice that both of his pinna are at the imaginary line to the outer canthus to the occiput. And I'm going to do a ear exam looking at the external ear with a pen light. So I'm first going to start off with the right ear here. I don't see any abnormalities around the surrounding tissues or on the ear. Brant, does it hurt when I touch your pinna?
No.
Great. How about your tragus? Any
No.
tenderness? Great. So I'm going to examine the internal ear using my otoscope here. I'm going to pull the pinna up and back. So upon assessment, Brant's ear is pretty impacted with cerumen. However, if this was a expected finding, I would see that the tympanic membrane has a pearly pinkish color, has a cone of light reflex, and is semi-transparent. So again, going to examine the external ear here, as well as the ear itself. I don't see any abnormalities or redness. Any tenderness, Brant, when I pull on the pinna?
No.
Any tenderness when I close your tragus?
No.
Great. So again, I'm gonna go in and examine the inner ear here. Again, Brant's ear is impacted with cerumen, which is an abnormal finding. So Brant, I'm gonna be doing 3 tests to test your hearing. I'm first going to start off with the Weber test. you're gonna hear kind of a ringing, and I'm going to place it directly in the center of your forehead. You tell me if you can hear it in both ears equally or one better than the other.
Both ears equally.
Great, so that means his bone conduction is equal on both sides. Now I'm gonna do the Rinne test on both ears as well. So again, this is going to test bone conduction to air conduction. So again, Brant, you're gonna hear that. I'm gonna first tap the tuning fork, which is a 512 tuning fork, to his mastoid bone. Now I'm gonna do in front of the ear. Which one do you hear better?
The front of the ear.
Great. The same exact thing. And again.
I heard more in the front.
The front, great. So that means that Brant does not have hearing loss. If it was the other way around where he heard the bone conduction more, that could possibly indicate that he has a hearing loss. And the last one that I'm going to do is the whisper test. So I'm gonna put this down. So Brant, I'm gonna stand behind you and I'm going to whisper something to you, okay?
Mm-hmm.
So we're first gonna test the left ear here. I'm going to take my finger and I'm gonna press down the tragus on the right ear. So I'm gonna whisper something and repeat it back.
Hat.
Great. Bless you.
Ooh, I had to sneeze.
It's
Excuse
okay.
me.
And then again on the other side.
Cat.
Great. So Brant could hear on both sides. So now we're going to move on to the nose. So if I'm looking at the external nose, I see that it is symmetric. I don't see any lesions. I'm going to come closer and I'm going to palpate the nose. The bridge of the nose feels firm and soft tissues yield to touch. I'm going to palpate the frontal sinus here. Any tenderness?
No.
And I don't notice any crackles. And the maxillary sinuses, any tenderness?
No.
Good, I don't notice any sort of crackles here. So now I'm going to test you can open your eyes, put your head down. Now I'm going to test the cranial nerve 1, which is the olfactory. So I'm going to place a substance underneath your nose. You tell me if you can smell it and what it is, okay? So keep your eyes closed. Go ahead.
Coffee.
Great. You can open your eyes now. Now I'm going to use my otoscope again. And I'm going to inspect your nasal cavity here. And do the other side here. So both nasal cavities are patent. The nasal septum is not deviated or perforated. No lesions or swelling noted. And the turbinates are pink, they're moist, and again, there's no discharge noted. So now we're going to move on to the mouth and throat exam. So when I'm looking at Brant, I can tell that his lips and his face are symmetric. I can tell that his lips are pink in color and there's no redness or swelling noted. So when I feel Brant's lips, I can feel that they are nice and soft. So Brant, I'm gonna have you open up your mouth for me. I don't note any sort of odor present. So I'm first gonna look at the buccal mucosa and the gums here. I'm also going to palpate them as well as I'm kind of moving along here. And the buccal mucosa and gums are nice and pink, no masses are noted. So Brant's teeth are nice and white, there are no cavities noted or any other dental disease here noted. Open up please. The hard palate is nice and pale and the soft palate is soft, smooth, and pink. So Brant, I'm going to use a tongue depressor. I just want to look at your uvula here. The uvula is midline here, and I'm going to have you say ah, and the uvula does rise midline. So I do have to elicit the gag reflex. Good, so that means cranial nerve number 9, which is the glossopharyngeal, and cranial nerve number 10, which is the vagus nerve, are intact. So I'm going to look at his tonsils, and the tonsils have no exudate on them. So Brant, now I'm going to look at your tongue here. So stick out your tongue for me. So the tongue is nice and midline. The tongue is pink and moist. Lift up your tongue for me. Underneath his tongue, there are no masses or suspicious lesions noted. The frenulum is midline here. So Brant, what I'm going to have you do now is I'm going to feel for the tongue using a piece of gauze here. Stick out your tongue. And again, I don't see any sort of masses or lesions noted on either side. And now what you're going to do is push against resistance for me. Great, and on the other side, great. So that means that Brant's cranial nerve number 12, which is the hypoglossal nerve, is intact. So Brant, we're gonna do one more thing here. We're gonna do the sweet and salty test to test cranial nerve number 7, which is the facial nerve here. So let me know if you feel something, taste something sweet or salty.
Salty.
Great, and then one more.
Sweet.
Great, so that cranial nerve is intact. So now we're gonna move on to the neck assessment. So just by inspecting the area, I see that Brant here has a scar right above his right clavicle. I see that his trachea is midline. I am going to palpate his lymph nodes here. Brant, I'm just gonna stand behind you, okay? So please let me know if you have any sort of tenderness, okay? So I'm doing the preauricular, postauricular, occipital, tonsillar, submandible, and submental. You have any sort of tenderness?
No.
Great, I didn't feel any sort of lymph nodes, they were non-palpable. Brant, I'm then going to place my hands kind of around your neck. I'm going to feel for your thyroid here. There are no masses noted. Brant, what I'm going to do next is I'm going to palpate your carotids, okay? So you're just going to feel my 2 fingers up against your carotid pulse here, which is 2+, which is to be expected again on this side. Also 2+. Now I'm going to listen with my bell to hear for a bruit. So Brant, I'm going to have you take a deep breath in and then blow out for me, and then hold your breath. Great. And then again on this side, take a deep breath in and then out, and hold your breath. Great, and no brewing noted on either side. So you're now going to do the first part of the respiratory and cardiovascular exam. So when I'm just looking at Brant here, I'm expecting his chest. I can note that his chest is soft, is smooth. I'm gonna have him turn to the side here. His chest does not have a barrel shaped to it, and he is not labored breathing. Now, normally throughout the respiratory exam, I would be checking for a respiratory rate. You do not want to let the patient know you are doing this because they may alter their breath sounds, but Brant's respiratory rate is about a 16. So I'm first going to palpate the chest, just feeling for any crackles or tenderness. I'm going to be feeling the thoracic muscles as well as the rib cage here. And Brant, is there any tenderness noted?
No.
Great, so I'm gonna have you turn here and we're gonna test chest expansion. I'm gonna be putting my hands on the costal margins. Brant, take a deep breath in and out. Great, and those margins are symmetric. So we are now going to listen to lung sounds, check for any sort of adventitious breathing noted. We're gonna be listening with the diaphragm. So Brant, take a deep breath in and out. Again, out. Again, out, out, again, 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 and again. Great, so we're gonna come to the right arm here, right underneath, and we're gonna do it again. Deep breath in. Great. Again. One more time. 2 more times. Great. One more time. Great. Now we're going to move to the other side here. Go ahead. Good. Good. One more time. Great. Put your arm down. Now we're going to be listening to cardiovascular sounds. We're going to be starting here at the aortic, which is at the right second intercostal space. So Brant, you can just breathe normally here. Now we're going to move on to the pulmonic, which is at the left second intercostal space. Now we're going to be moving down to Erb's point, which is at the third left intercostal space. Moving down to tricuspid, which is at the fourth intercostal space. And lastly, the mitral, which is at the fifth intercostal space, at the midclavicular line. S1 and S2 is noted. I'm going to go back and listen for any sort of bruits. And I'm using the bell for this. No bruits or murmurs noted. This is the second part here. So again, I'm noting any sort of palpating the thoracic muscles, noting any sort of tenderness reported by the patient. I'm also going to be touching the rib cage. Any tenderness?
Nope.
Great. No crackles or rubs noted here. So I'm going to next put my hands at T9, T10 of the thoracic spine to test the thoracic expansion. So Brant, please take a deep breath in and let it out, and that was symmetric. I'm next going to ask the patient to say 99 to test the tactile freminess to hear vibration throughout the lung fields here. So go ahead, Brant.
99, 99, 99, 99, 99, 99.
Great, and vibration was heard throughout. Next, what I'm going to do is the diaphragmatic excursion, which is going to test the reticence to dullness in the lung field. So it's important to know that on the right side of the body, the area might be a little bit higher due to the liver. So I'm first going to percuss the area, and then I have a marking pen here, and I'm going to mark it. So Brent, I'm gonna have you take a deep breath in and hold it, and let it out here. Okay, so where I started to hear dullness was about here. And then Brent, take a deep breath in, exhale, and then hold it. Okay. And that's about right here. So this measurement would be about 3 to 5 centimeters. That would be the length of the, from the dullness to resonance, and you would do that same exam on the other side. So now I'm going to percuss all areas of the lung field. Great. And reticence was heard throughout the lung field. And lastly, what I'm going to do is listen to Brent's lung sounds here using the diaphragm. Brent, take a deep breath in, out, in and out. Great. Again. Great, again. 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 One more time. And one more time on this side. Great, breath sounds are clear. They were heard throughout the whole entire lung field. No adventitious breath sounds were heard. So to finish up with our exam, as you can see, Brant is in a supine position. He's about a 45-degree angle. We're going to see if he has JVD. So looking on the left side of his neck, I do not see JVD present here. And we're going to look on the opposite side and no JV present here. So we're going to start from the upper, move down to lower, and look over our pulses here. So we're first going to start off with the temporal. Both sides bilaterally are 2+. We're going to move down to the carotids. We're going to only do one at a time here. 2+, and 2+. We're going to move down here to the apical pulse, which can be found at the apex of the heart. At this point, if you wanted to assess for the pulse, you can do this for a minute. But this area is pretty bounding. It is a 2+, 2 or 3+. Again, all the 2+ pulses are to be expected. That is a normal finding. Then we're going to move down to the brachial on both arms, which again are 2+, moving down to the radial, which are as well 2+. So I'm going to take a pause here, and I'm going to look at the aortic, renal, iliac, and femoral arteries here. So just based off of inspection so far for the aortic, renal, and iliac, I don't see any sort of massive bulging, or nothing is kind of racing here. I'm going to be palpating these areas. I don't feel any lumps or masses or anything that is abnormal. So I'm going to now take my bell and listen for any bruits here. So starting at the aortic, no bruit noted here. Moving down to the renal, no bruit noted on the right, no bruit noted on the left, and moving down to the iliac on the right, no bruit noted, and no bruit noted. So now, to maintain as much privacy as we can, we're going to move to the femoral area here. Okay, no Brent, keep your legs straight. So I'm first going to be feeling here. Sorry. Again, no sort of suspicious balls, nothing is bounding. We're at a 2+ here. I'm also going to be auscultating to listen for any sort of bruits. So none noted on the left, and none noted on the right. So to finish up, we're going to move down the leg, feeling the popliteal. So I'm going to have you lift up your knees, feeling on the behind the knee. Both are about a 2+. Looking at the posterior tibial here, also 2+, and the dorsalis pedis. which is also at a 2+, and again, 2+ findings are to be expected.